A removable partial denture is a metal framework with plastic teeth on it. It's used to replace one tooth or more, but typically more teeth than just one. It is such that it goes in and out, and it's dependent on the other teeth, such that the teeth on either side of the spacing has to be that they're in good condition. So periodontally, we try to make sure that those teeth are in good health, so that when the partial denture is clipped to those teeth, then it will survive for a long period of time for that investment. In deference to a partial denture, there's the fixed partial denture, or more commonly called the fixed bridge. Typically, this is done when a tooth is missing or several teeth are missing, but there must be a tooth on either side of the space. Those are then used on either side of the space to support this framework that's glued into place. It's got the advantage over the partial denture because it's glued in place. It stays in 24 hours a day, as opposed to the removable, which comes in and out. However, it's not flossable, and over time there can be recession that makes it less aesthetic. So there are things about it that are positive over a removable denture, but not necessarily over the long term the best for the patient. A dental implant has advantages over a fixed denture or partial denture. It does stay in place 24 hours a day, but it only replaces the tooth that's actually missing. It's not dependent on any of the other teeth on either side of the space. It's flossable, it feels and looks like a natural tooth. And so it may be the more expensive option, but it's often the best one for patients.